recent case out of Texas is raising serious concerns about medical care, vaccine safety, and public health policy. According to the Texas Department of State Health Services, Daisy Hildebrand, a school-aged child from Lubbock, died on April 6, 2025 after testing positive for measles. The state described her cause of death as measles pulmonary failure, part of an outbreak that has now seen 481 confirmed cases. The press release strongly suggests measles was to blame, warning that the virus can lead to severe complications like pneumonia, especially in the unvaccinated. But not everyone agrees with that conclusion. Dr. Pierre Corey, appearing on Children's Health Defense TV, stated, "This child did not die from measles. She died from a hospital-acquired bacterial infection that was misdiagnosed and mismanaged. The focus on measles blinded the healthcare team to what was really happening." Dr. Corey is a critical care physician and well-known figure in the medical freedom movement. He claims that Daisy's death and another child at the same hospital stemmed not from measles, but from serious medical errors. He reviewed the girl's records and paints a troubling picture. Daisy was first hospitalized with pneumonia. She was treated with antibiotics, which Dr. Corey says deviated from standard pneumonia protocols. Additionally, a PCR test result was positive for measles near the end of her stay. Still, she improved and was discharged. But just one day later, her condition deteriorated, landing her back in the hospital, this time in critical condition with both lungs failing. Corey argues that during the second stay, doctors wrongly assumed her worsening pneumonia was measles-related, delaying proper treatment. Trial Site News has included a timeline of events according to Corey's interpretation as presented to CHD. According to Corey, hospital-acquired pneumonia should have been on the radar, especially after an ICU stay. Instead, they didn't expand antibiotic coverage, and it wasn't until days later they found an E. coli infection, resistance to most drugs. By then, it was too late. Dr. Corey's opinion? Daisy died from that E. coli infection, not measles pneumonia, as the hospital and state officials implied. He even suggests her unvaccinated status may have biased the care she had received, raising ethical questions about how hospitals treat patients during outbreaks. Trial Site News has reached out to both the hospital and state of Texas for comment, but as of this recording received only reply from the Texas Department of State Health Services stating the health department is prohibited by law from sharing a person's medical record. This case comes amid a heated debate over vaccine safety and public health policy. Texas DSHS continues to stress the dangers of measles, while critics like Corey argue that fear of the virus is overshadowing bigger issues, like the quality of medical care. Trial Site News is now calling for an independent review of Daisy's medical records and death certificate to get to the truth. Daisy Hildebrand's death is a tragedy, but the questions it raises could have far-reaching implications. Was this a failure of the healthcare system, a misstep in public health messaging, or both? As this story develops, we'll keep you updated. For now, transparency and answers are what's needed most.